I'm Ken Schaefer, and I'm here to talk about all things related to men's sexual health. Tonight, I'm covering the J in the ABCs of men's sexual health. For the J word, I'm going to talk about Jelqing. And Jelqing is a very ancient practice, and it's often referenced for people who are trying to make their penis bigger. And it might work for that. It might help you make your penis slightly bigger, but it can be used therapy, especially for men with ED. And the thing with ED is over the course of time, because you're not getting erections, or you're not getting enough erections, or you're not getting very good erections, your penis is not getting enough blood to keep the tissues healthy. And this is where Jelqing can come in, particularly if you combine Jelqing with using a penis pump. And I've talked about pumps before, I believe. Basically, a vacuum penis pump is a vacuum pump that you put over your penis, and you use negative pressure to create an artificial erection. And you go back and forth doing that several times. So, what you can do is when you're pumping your penis to get blood flow in there to help the tissues revitalize and regenerate, then you'll intermittently release the pressure. And when you release the pressure, you can take the pump off and do Jelqing. And what is Jelqing? Jelqing is using your fingers to help push blood into the penis. And it works like this. Your penis, you wrap your fingers around the base and then massage upward towards the top of the penis. And you keep doing that for a certain amount of time. And if you want to try it, I would suggest looking up some information, seeing how long people do this and how often. If you're pumping, I would encourage you to pump a minimum of 3 times a week and as much as 7 times a week. Because if you have erectile dysfunction, especially if you've had it for a long time, you need to get blood into the penis to help regenerate and rejuvenate those tissues. So with Jelqing, it's an add-on. You pump, release the pressure, remove the pump, and then massage blood up into the penis. I would suggest at least 30 seconds. There are different pumping protocols. There doesn't seem to be scientific research done on what optimal protocols are for pumping. I've worked with one doctor who had me pump for 3 minutes on and 2 minutes off. And during those 2 minutes, the doctor had me do Jelqing. I've worked with another doctor he said, pump for a minute, release for 30 seconds, pump for a minute. And in the first case, I was doing that 3 minutes, 2 minutes for a total of 3 rounds. So it was about a 15-minute protocol. With the other doctor, he would have me do it for a minute, release for 30 seconds, and have me do that for 5 rounds. So it was about it's about a 7.5 minute protocol. It was easy to add Jelqing in with the longer protocol because it takes time to get situated and then start the Jelqing process. The short call, I would have to probably vary it because if you're only going to release the pressure for 30 seconds before you start putting pressure or using pressure again, you're not going to have time. So you would have to vary the protocol a little bit. But I'll go back to what I was saying. There doesn't seem to be any research or scientific consensus on what an optimal protocol is and under what circumstances would you want to do one protocol versus another. I think the important thing is that you are getting blood into your penis. Okay, so Jelqing is a relatively simple thing, but do your research, get online. There's some great articles. I'll put out some information on my social media. I may even publish a blog post about it on my website. So that's it for today. That's all I wanted to talk about. Little discussion about Jelqing and pumping as well. All right. Until the next video, thank you for watching. Goodbye.